Hello, I'm Dr. Clint Sexton, and I've been practicing functional medicine for 18 years. Today I want to talk to you about a health series called Women's Digestion Solutions. Women's digestion issues are one of the most common problems that I actually deal with in my office. Now you might be wondering why I have a series dedicated just to women's digestion problems. The reason I've done this is because the digestive system and the way it works with men and women is actually not the same. Now it's true that we all have the same organs, essentially doing the same processes, but women have a unique set of circumstances that can influence how their digestive tract actually functions. So if you suffer with gas or bloating or a sense of fullness, or you get nausea, or you're getting fluctuations in digestive function as your hormones shift, or if you're dealing with any inflammatory bowel issues, or conditions called SIBO, maybe you've heard of that one, SIBO, small intestine bacterial overgrowth, that situation, or leaky gut, these kinds of things. These are all going to be a little bit different for a woman than it would be for a man. Now the majority of my patients are women, and so I've worked with these type of digestion issues for many years now. I've been practicing for 18 years doing this, and we can help sort out the differences and how they affect you. The Women's Digestion Solutions series is a 5-part series. So in part 1, we're going to talk about diet and nutrition. In part 2, we would look at the impact of hormones and how those influence the digestive tract and how it's working. In part 3, we would look at the gut flora. And so that's talking about the different organisms and bacteria that are living in the bowel. And we would also talk about the use of probiotics and prebiotics. In part 4, we would look at a couple specific conditions, something called SIBO, which is small intestine bacterial overgrowth, and we'd also talk about leaky gut. But the last part of the series, part 5, is really important because this is where we talk about the neurotransmitters. And neurotransmitters are chemicals, things like serotonin and dopamine. You produce a lot of those in the gut, but you also produce a lot of those in the brain. And many times we find that women who are suffering with digestion issues also have problems with anxiety or depression or insomnia or migraines, which we also associate with neurotransmitter problems. So to really get a handle on the digestion issue, we have to look at the chemistry of the gut and how that ties to the brain. We call that the gut-brain connection, and that's really important. So those are the things that would be included in the series. So this series is going to give you a much better understanding of how your digestive tract, how it works, and how it's different than a man's digestive tract. Again, the statistics show that women have more of these kinds of problems, and this series can differentiate and allow you to see how your body works differently than someone else does. And no one else is talking about this. So I created this series for you, for women, so they could get this information and to make empowered decisions about their health and get better solutions. Because the solutions being offered today are basically nothing. If you have this condition and you go to your physician, you're essentially going to get one of 4 recommendations. They're going to say, eat more fiber, they're going to put you on an antibiotic, they're going to put you on an antidepressant, or they're going to put you on something called an antispasmodic so your intestines don't go into spasms. Those are not solutions. So you essentially get 4 options that are typically offered. These are not solutions to the problem. Women don't need more drugs, they need better answers for how their bodies work differently. So if you're interested in this series, just provide your name and your email, and I will get step 1, part 1 of this series sent to you today. Thank you for watching this video. I wish you happiness, health, and I hope this series changes your life.